Welcome back to Morning Rush. Well, as we recognize Breast Cancer Awareness Month, today we want to take a closer look at racial disparities in breast cancer rates. While Black women are less likely to be diagnosed with breast cancer, they are more likely to die from breast cancer than white women. Black women are also more likely to be diagnosed with more aggressive types of breast cancer. So here with us today is Regional Clinical Director and Medical Director for Carbon Health in St. Mary's Hospital, Dr. Bayo Curry-Winchell. Thank you so much for joining us today, Doctor. So let's talk about these disparities. What are the driving factors and the forces behind them?
Well, first, thank you for having me.
Of course.
There are so many factors that are involved. Number one is access, as well as offerings to getting screened. And that is really key because the opportunity to actually get screened really can make a change in that trajectory as far as early diagnosis and treatment.
And, doctor, we always hear, pretty much with any illness, that you can get, that early detection is key and being proactive is key. But what are some obstacles that Black women face then when it comes to prevention? Is it just a matter of, them not being exposed to it?
It is. So it's multifactorial. We have to think about the offerings. When they are in exam rooms, Black women are less likely to be offered a mammogram. And so that part is key, as well as access to care. And there are other factors such as social economic factors as well. So it's really important that Black women advocate for our health because we deserve these screenings. And it's unfortunate that we actually have to ask for it. But I really stress to all women, make sure you get screened. It can save your life.
Definitely. And you've probably heard this from patients that you've come across, seeing those pamphlets, whether it's, at a grocery store, in your child's school or anything. Like, I know that kind of, for me, it's like, oh, I need to actually pay attention to that. I may read a little bit more about what it actually is. So I'm sure that plays a huge role. But I want to talk about how you recorded your mammogram and diagnostic journey. So can you tell us about that and why it was really important for you to show the world basically what you were going through?
Absolutely. As a mom, a doctor, and especially as a Black woman, it was really important to me to find a way to advocate for my patients. And so by using my experience of having my first mammogram, it really allowed insight into what the exam is involved, as well as inspiring women to, if you get an abnormal result, as I did, to continue forward and find out what that means. And so by, providing insight into what a mammogram is, what is a diagnostic exam, that I hope really inspires women to go and get screened because that test can save your life. And so I'm so grateful to offer this to my patients and really provide a higher level of connection from a doctor as well as to my patients.
So, doctor, would you say that, kind of going off what you were just saying now, do you think that there is a fear that's associated with knowing? Sometimes people probably feel like ignorance is bliss and not really knowing what's going on. Is there a fear attached to that? Maybe why people don't necessarily go get screened?
Yes. And, that's unfortunate. And that's why we have to improve health literacy. When patients know this is what the exam will involve, these are the steps that you have to do to move forward, that can really help quell those fears and really inspire women to move forward and get their mammogram.
Definitely. So let's talk about what's called triple negative breast cancer. What exactly is that? And why are Black women at higher risk for triple negative breast cancer than white women?
So triple negative breast cancer is a very aggressive breast cancer and is associated with a very poor outcome. And unfortunately, Black women are disproportionately affected by this cancer. And there are several reasons why. We know, number one, access and offerings to getting the mammogram, as well as late diagnosis. And that really changes the trajectory of treatment. So Black women are unfortunately really at a higher risk for this very aggressive type of breast cancer.
So on our screen just now, we had, Black women and breast cancer and highest deaths. That was one of the bullet points. But then another one was highest exposure to carcinogens. What exactly is that connection there?
So there are several things. When we think of number one, housing, exposure to, different environmental conditions can really change your risk factors for getting breast cancer. And unfortunately for Black women, when you look at especially, systemic racism, whether it's, through housing or just different factors, that can change the needle, as well as exposure to, different products, whether it's hair products and so forth, that have over time been really socialized to the Black community. That changes the risk for Black women, unfortunately.
Definitely. That makes a lot of sense. Dr. Bio Curry Winchell with Carbon Health in St. Mary's Hospital. Thank you. Thank you so much for being here today.
Thank you for having me.
Of course.